Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hi, Dr. Normington. How are you today?
Great. How are you?
I'm good, thanks. So today I wanted to talk to you about a procedure that you do quite often here in the office, probably what we do the most of, Botox treatments.
Sure.
Can you explain to me what exactly Botox is and how that works?
Sure. So we have a pretty extensive experience with Botox. Botox is a medication that weakens muscles. And many of the lines that we all get on the face are caused by muscles below the skin. So on the forehead, all those lines are caused by the muscles that lift the eyebrows, and the furrows are caused by those scowling muscles. And around the eye, the squinting muscles cause those little crow's foot lines. So rather than use a wrinkle product or a wrinkle cream, the primary problem is the muscle. If we weaken those muscles, all those lines will improve. So Botox is simply a medication that weakens muscles. Botox is botulism toxin. You may have, I remember growing up, my people were all worried about botulism. Well, that's what it is. It's botulism toxin, but it's made medically, and it's made for the purpose of weakening muscles. In medicine, they use it for medical problems. There are people who have overactive muscles, and it's used medically to weaken those muscles. But really, it came out first to weaken some of these cosmetic muscles on the forehead and around the eye. So we have a very extensive experience with Botox. I've been doing Botox maybe for like 25 years. And the Botox company tells us that we are the largest provider of Botox in central Pennsylvania, even in more than Harrisburg and some of the other cities in the area. So we have a very extensive experience with it. We do hundreds of Botox patients a week, I believe. So we have lots of patients who undergo these treatments. The treatments are quick. Mm-hmm. It literally takes a few minutes to do it. In fact, our patients probably wait a little longer in the waiting room for the treatment than the actual treatment takes. So it's a pretty quick treatment. Most people go right back to work. There's no reason to hide out or anything. The only real restriction is probably best to not have the treatment and go right to the gym or go home and split wood or something. So you want to kind of take it easy for a couple of hours. But again, most people come over on lunch breaks or things like that and go right back to work. It's not a permanent treatment. That's probably the biggest problem with Botox. It is temporary. It lasts generally, for 3 to 4 months, and then we need to be repeated. So patients do come a few times a year for these treatments.
Right.
Patients always want to know how much it costs. It's a vague answer. So basically, with Botox, we charge for the amount of the medication that we use, obviously, a big man will use more medicine than a 70-pound woman. But in general, to treat your forehead and those scowl lines around your eyebrows, you're looking, less than $300 in the high $200 range. And then to treat the crow's foot lines, it's another basically a couple $100. So, generally a patient will spend somewhere in that range for this sort of treatment.
Right.
Yeah.
And would you say there's a specific person that's a good candidate for Botox, or is it really just anyone that kind of is unhappy with wrinkles that they see in their face?
That's a good question. I think younger people are better candidates because as we get older, there's a limit to what Botox can do, and then some of those problems in an older patient probably should be addressed surgically.
Right.
But I think we have a lot of patients who have Botox in their 70s. So, it's anybody's possibly a candidate. But generally, if you're younger and just looking to prevent wrinkles or prevent any permanent change from a wrinkle, those are good candidates. So we have some women in their 20s who treat their lower forehead, those scowl lines, just more of a preventative thing, I think.
Yeah. So would you say there's an age that's too young to start having Botox, or is it really just up to the patient?
It's up to the patient. I don't think I've ever treated somebody in their teens.
Okay.
But we do have a lot of patients in their 20s who are seeing some things that they're concerned about, and Botox is a way to kind of nip that in the bud.
Right.
Yeah.
Yeah. And so what other areas you mentioned, forehead and crow's feet? Is there something I've read about the nasolabial folds around your nose?
Yeah. So there are so really any muscular problem we could potentially treat with Botox. We do treat some things around the mouth. Mm-hmm. Unfortunately, you have to be real careful around the mouth because everybody wants to smile and talk and not drool.
Yeah.
So, but there are a lot of things that we can treat around the mouth, like some of those vertical smoker lines, things like that could be treated with Botox.
Great.
So we do treat around the mouth. Cosmetically, the other thing that we use Botox for is underarm sweating. Mm-hmm. Believe it or not, those the little sweat glands in our underarms have muscles that control the sweat. So we can use Botox to reduce sweating. And we have a whole lot of women who come in, every few months to have that done because they're sweating too much and they're ruining clothes and that sort of thing. So right. That's a big thing with Botox as well.
Yeah. And that treatment would be cosmetic, you said?
Yeah.
Okay.
Yeah.
Is there ever a situation where someone could have Botox covered by insurance?
For problems from overactive muscles, I think the most common thing that we treat, there are people who have eye twitches and, that's the big one, eyelid twitches or eye twitches from overactive muscles. And that twitching can become a real problem. And that's the sort of thing sometimes an insurance company will, take care of that sort of thing.
Right. And we've had a couple patients I know of that somehow have had Botox that has lifted their eyebrow. Is that a possibility?
Right. So if everybody goes in front of the mirror and look at yourself, if you scowl, you'll see that your scowling muscles are pulling your eyebrows down. Right. So by weakening those scowl muscles, they can't pull your eyebrows down, so your eyebrows actually then will elevate. So It's a nice way to get a little bit of eyebrow or forehead lift, mm-hmm. Non-surgically. So most patients who have a treatment on their forehead will notice some sort of elevation of the eyebrows.
Great.
Yeah.
Yeah.
And that can really brighten the eye. Even lifting the eyebrow up a millimeter or two will make the eye look brighter and less tired looking. So that can actually make a nice change.
Yeah. And would you say it's important for patients to kind of keep on top of it and have their treatments every 3 to 4 months when they're seeing that it's wearing off?
Yeah. Well, what I tell folks is you want to keep these muscles weakened. Mm-hmm. So the muscle is pulling on the skin and causing problems. And if you keep that muscle weakened, the results actually improve over time. So we encourage patients to not let that muscle regain strength, so not letting the medicine wear off. So it does mean coming back every 3 or 4 months typically.
Yeah.
There are some patients who think they get 6 months out of it. I have 1 or 2 patients who swear it only lasts 6 weeks. So, but most people it's 3 or 4 months.
Okay.
Yeah.
Great. Well, I think that's all for today.
Those are great questions, Jordan.
Great. Thank you.
All right. Thank you.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.